Hello, everyone. I'm Lee Carroll.
And I'm Monika Muryani.
Welcome to another program that we call Topics for Our Times. This is the 5th episode in this series. The show is based on many things that are so very hard to deal with in life and so very hard to also talk about. And every so often there's an individual who is exceptional, unusual, and helps us all to work this puzzle. And this is one of those times. These programs, all of them, are about heroic recovery and balance.
Now, not only have we met those who have recovered from unspeakable things, but they have become champions at helping others through many of the same issues. And that is what this program is all about. There are so many kinds of situations and so many stories to tell. And Lee and I want to present the gems and peek into the lives of some of the ones who are making a difference in their own life and in the lives of others.
So let me introduce to you one of those gems. Is that going to be all right? We wish to present to you Cindy Tank Murphy. Cindy is a best-selling author with her #1 Amazon book, The Strength to Live. She is an international speaker and mental health advocate who is passionate about writing and sharing healing stories. Based on personal experience, Cindy offers a unique perspective to the conversation around surviving suicide and the mental health epidemic.
Cindy believes we can eliminate the stigma that's associated with mental health through awareness and open dialogue, ultimately saving lives. And Cindy's life was forever changed on July 22 of 2014 when her father ended his life. And that's when Cindy was left with a choice to make. She could allow shame, guilt, and sorrow to swallow her whole, or she could seek better understanding through education and a new version of herself through self-discovery. So thankfully, she chose the latter, which began a massive shift in her healing journey. And it's a healing journey that has had a profound and lasting impact on her future. And it's called her to kind of step up and to become a compassionate voice regarding mental health.
Her personal experience, perspective, and passion for sharing her experience make her an ideal mentor and a compassionate voice for those struggling emotionally with suicide loss or dealing with someone that they love battling mental illness. Through her dedication to raising awareness and providing support, Cindy gives a compelling and personal account of how she began her own healing process and provides support steps to help her readers and those listening, even today, to do the same. In her debut solo book, The Strength to Live, she shares how to move through grief and find the hero in you, I love that, on the other side. Cindy, welcome to our program. I'm so glad you're here.
Thank you so much. I appreciate you both for having me on today, and I'm just thrilled to be here with you.
So.
I know I've been talking a long time, but I can go ahead, Mom.
I was just wanting to say, just again, if you can share with us those moments, those many moments that led you to become that compassionate voice for mental health.
Yeah. So, my story begins really as a child growing up in a small rural community in Northeast Iowa. I'm the oldest of 4 children, and I grew up in a loving family. I believe that, my childhood was really a typical childhood for someone growing up in that community. But there was just something slightly off. I say that it was just something that people couldn't see from the outside, but that little bit of something that was different was that mental illness was in my family. And, people kind of wonder what that looks like or what that means when I say that. But really, that just means that, I had this loving father who at times would, take me on these wonderful adventures, and we would do wonderful family things together. But then at the very same time, he could be just cruel and really agitated and, verbally abusive at times. And so I didn't know what that was as a child, but as I grew older and started to learn more about people around me and my surroundings and things that were happening around me, I began to understand more what that meant. And the very first time that I learned that someone had died from suicide was when I was in the 4th grade, and it was my elementary school principal. And I remember the look of despair and sadness on my teacher's face at that very young age of 9 or 10 years old. And I thought to myself, I really can vividly recall that. And I thought to myself, why would anyone want to end their life? And from that moment on, I believe that my life journey was being laid out in front of me. I had, again, this was a very small hometown that I grew up in, about 3,500 people. And throughout my childhood and teenage years, I had known several people within that community who had passed away by suicide, including a cousin in a neighboring community, a friend's boyfriend in high school. It was just almost inexplicable to me that there would be so many suicides in such a small place. And then as I grew older and into my teen years is when I discovered and realized that my own father was battling a mental disorder his entire life. And I found out later that he had developed it probably at a young age. He was drafted in the Vietnam War and was shortly thereafter honorably discharged because of an apparent mental breakdown. So I started to put the pieces together of the genetic connection, the biology connection, the environmental connection, and the life stressors. And I really started to think about how mental illness impacts people and why it can bring people to the point of suicide. Then I went on to college. I graduated with a journalism degree, and I always have enjoyed writing. But it wasn't until I started my career. I was working at a newspaper in Iowa, the Des Moines Register, and on my 24th birthday, my coworkers and I witnessed a man jump to his death from the parking garage across the street from us. And it was as if suicide was following me. I went on to move from Iowa to the Chicago suburbs. And once again, I would have friends that would tell me that they lost a dear high school buddy because, the person had decided to stop taking their psychiatric medication because they were afraid it would show up in a drug test for a vice president position. It didn't matter the socioeconomic status of people, the gender, their background in any sort of way, their upbringing. It just seemed that this was something that was impacting people of all levels and all kinds. I noticed it in my daughter's high school when within a 2 to 3 year period, they had 3 suicide deaths. Mm. And it was really something that was surprising to me. And then, of course, prior to that, in 2014, I lost my father to suicide. So all of these things were kind of this culmination of this calling, I call it. But it was always this nagging in the back of my mind of why have so many people died by suicide in such a small town? And why was it still around me? And I was seeing so much of this when we don't hear a lot about it on the news. We hear about murders and wars and deaths of that nature, but suicide's not something that's really talked about. Mm. So as a survivor of suicide loss, the one thing that I can expressly say and people that I talk to understand is that there's always this layer of extreme grief when anyone dies. There's this loss that's a void that's hard to fill. But in the case of suicide, it goes even deeper than that, because on top of the grief, there's layers of shame and guilt and anger and this questioning over and over, why did this happen? And so when I started to see signs in my 15-year-old daughter at the time, she started to show depression, anxiety, severe anxiety. She had been, we had gotten her some therapy in the 4th grade because she had been bullied in school. And I was seeing these signs, and I just could not, hold back these questions that I had any longer, because I was really starting to fear that I could possibly lose my daughter, the same way I lost my father. And so it was at that point that I knew I needed to do something. And I didn't know exactly what that was, but I knew that I needed to begin with educating myself. And that's where I started. And that road of education led me on this path.
Yes.
That actually helped in my healing.
So there's many, I feel sure, watching this now who may be going through similar circumstances. And I've also known those who have children who are self-harming. The biggest question is, what do I do? How do I help that loved one of mine who is in pain, is self-harming, is having suicidal thoughts? How can we help them?
That is a great question. I'm so glad you asked it, Monica. The first thing to do is to ask the person, point blank, just say, are you feeling sadness and depression to a point that you are concerned or maybe concerned that you want to harm yourself? And we have to be able to do that. We have to be able to address it straight on. The thing that's important about that is that the person that's dealing with this pain and this constant chatter in their minds that they don't want to be here any longer, they're afraid to tell anyone that, because they understand how that'll impact people. And they're afraid it could be taken negatively, of course. And so by you opening up first and foremost and asking those questions and just saying, I noticed there's been a change in your behavior or your mood. I'm concerned for you. I want to understand if you're thinking that this is something that we need to address. I'm here to support you. And then listen. And when you can open the door just a crack, you allow them then the ability to trust that you're going to listen and not judge. That is the biggest key, is that you listen without judgment, without saying anything. Do not interrupt them with, oh, it'll get better, everything's going to be okay. Those are not the right things to say. What you want to say is, I understand, I'm here to support, let's work through this together.
Do you think if someone is still kind of not able to open up, that the next kind of dialogue would be, if you can't open up to me, let's find someone who you can open up to? Because let's face it, when we're kind of so close in the family, it can be difficult to open up. What's your comments on that?
Yeah, that's absolutely true. So, luckily for me with my daughter, I got to that point, but it didn't happen overnight. There were many times where I took her to a mental health a therapist, or we took her to a behavioral center, and we sat down and we explained to the staff there and said, this is what we're concerned about. And then she would sit down with them and she would tell them what she wanted them to hear. She was very good at hiding it. And a lot of people dealing with this are very good at hiding it. But I would say, don't stop there. Keep going. It was finally a breaking point where she was spiraling downhill so quickly. I knew I needed to intervene. And I had taken a mental health first aid awareness training. And that is something that I think every person should invest in, because when you can understand the signs and you can understand how to respond, it's so valuable. It's no different than like if you are trained in CPR to help in an emergency situation, you can be trained in first aid response. And there are several different techniques, but by just understanding what questions to ask and knowing, is this severe enough that I need to take it to the next step? And that may be from, yes, it's very severe, I need to stay with this person and not leave them, and I need to call 911, or I need to call a crisis line. Or it could be, I need to get on the phone and help this person find a doctor that we can get an appointment with, and I need to take them there and ensure they get that help. It's important to understand that it's very difficult to navigate this when you're dealing with the emotional and the mental difficulties. There's a lot of physical and mental complications going on at the same time, and so it's very difficult for a person to logically know the steps they need to take. And so it's important that someone's there to help them along the way and help them bridge those steps of getting the help. And it's also very scary for a lot of people. I didn't know where to begin. I obviously, even after being trained and after losing my father and going through all the things I had gone through when I was dealing with my own daughter, there was this fear that I was almost frozen with, I don't know what to do. But, it's just steps, it's baby steps, one at a time. And it's knowing that you are doing it in a compassionate and kind and caring manner. I think all too often, a lot of times people and families, their approach to this, they don't understand why someone isn't getting out of bed, isn't able to go to work, isn't able to do simple things like brush their teeth and shower, and they think it's a willpower thing, that they're just lazy, or there's not enough willpower. They don't understand that there's a chemical imbalance going on, and there's a lot of neurotransmission disorders that are happening in the brain. And so you have to treat this no differently than you would any other health concern.
I want to ask this. This is just one facet. There's two sides to this. There's probably several sides to this. Mm-hmm. And we've looked at those who are in trouble and how to deal with it, especially their family. But there is the other one. And now here is a family who has actually suffered the event. And that is, what do you do? The first thing I would imagine is, what did I do wrong? Why do they want to leave? It's my fault. Yeah. There's blame, there's grief, there's whatever. This impacts an individual so hard, especially when it's a child, but then as, of course, a parent as well. So what did you do that you can report now, and I'm quite sure it's in your book too, to help you get through that?
Yeah. So as I mentioned, there are these layers of shame and guilt. And what didn't I do? Why did this person leave me? There's so many things that happen. But, the thing that I did is I looked at my father, and I knew him very well. I knew what kind and caring person he was. I knew that he would never have wanted to leave us in the pain that he left us in. And so I understood that he was in such a place of pain that nothing else around him, he couldn't even sense the things around him. I think that when you're dealing with a family that you, or a friend, let's just say someone who has gone through this is a very difficult thing. It's a fearful thing. A lot of people will really push people away. They don't want to talk about it. They're scared. And so the thing that I try to tell people is, you need to address it. You need to ask the person how they're doing, but you also need to respect them. And this was a life that was lost. And so if you can share a story about that loved one, if you can, approach them with, how can I assist you in this? And I'm here for you, that kind of thing. It's no different than any other death, but I know a lot of times a lot of my friends and neighbors, like no one wanted really to be around me after this because they didn't know what to say.
I think
And that's a very difficult thing.
I think
That's a
that's
big one.
exactly the key.
Yeah.
We don't know what to
We
say.
don't know what to say.
And I feel too that this kind of subject, it's uncomfortable. And we don't like being comfortable. You began with saying, we want to just make sure, get better straight away. We don't want to kind of open up the space to just allow that person who's in pain to express everything, because we're so used to numbing out our uncomfortable feelings. So yes, that's such an important point. We don't know what to say. So from your perspective, what are the things that people should say that would
And before she even answers that, I want to chime in with what my recommendations are, because I have seen this as well. And that there's some things that people, that just melts them. If you've had a person who's gone through this, it takes courage on your part if you just knock on their door and look at them and say, I love you so much as a friend and I'm here to do whatever. Now or later, please call me if you need it. And you can stay or walk away. But that is one of the things that can open a door with just love. But that takes courage too, because it's hard to be around a person. You don't know what to say, as you said. So please go ahead and, as a professional.
Yeah, I mean, you've given such great ideas, but the thing that I found so true when I started to write my book, and when I interviewed several people in my book, because it's not just my story, but it's the story of other people's loss and how they regained their strength after the loss. And every single story I heard, there were common themes. And those themes were, I haven't told anyone my story. No one's really wanted to hear it. Everyone's fearful to hear it. And when I reached out and said, I want to hear your story, I'm here to listen, it was amazing. One woman in particular, she had lost her husband 20 years earlier, more than 20 years earlier. And she told me the minute we started to talk that she had never told anyone the full story. No one knew exactly what happened that day, how everything transpired. And after 2 hours I spent with her, and she shared the entire story from the moment she met him to the moment that she recovered. It was like this release of 20 years. And 2 months or 3 months after that, she texted me to say, Cindy, I'm telling my story at my church. I'm giving a testimony. Think about that.
Yes.
That is profound.
Yay.
Yes.
Yes, that's profound. So it's us listening and allowing people to share their stories that get them over the hump of that fear. And when you listen and you can compassionately, empathy and step in their shoes and understand where they're coming from, that's what helps us as survivors to come out and come forward and to share our stories. And that's why I felt so strongly about myself sharing my story. I began to share it on a stage. I began to share a story actually of a 12-year-old girl and a mother that I had met through my, what I would call divine intervention through my journey. When I knew that my daughter was really struggling, I said I was really questioning why so many people had died in my hometown. And without knowing what else to do, I typed in Google. I said, why have so many people died of suicide in New Hampton, Iowa, which was my hometown? And what came back at the top of the page on that day was a guest speaker coming to my community, my hometown community of New Hampton. And her name was Christine Schmidt. And she had just lost her daughter at 12 years old, 2 years earlier, to suicide, the same year my father passed. And there was no coincidence there. I needed to meet Christine because I was being given this gift that I need to understand what she's been through, because I feel like I I can tell this story. And so when I started to share that story and when I started to open up, it was amazing. People would come up to me after I spoke and they would say, I lost a loved one, but I've never told anyone. I lost a brother when I was in, my early 20s to suicide. I lost my father passed away. Like, people I had known for years and never knew that their loved one had died by suicide, and complete strangers would come up to me and start to share their story. By me being vulnerable and sharing my story, I gave permission to them to share their story. And that's what we need to do. That's what we need to do for people struggling in the situation they're in currently, is be vulnerable enough to step forward and say, I'm here for you. I'm supporting you. I want to understand you, because that vulnerability will then spill over to them and hopefully open that door enough for them to tell you what they're going through.
You also mentioned something I'd love the listeners to know now, that they're not getting on the news, and they're not getting it anywhere, and that is some of the statistics.
Yeah.
If you think you're kind of remote with somebody who may have mental illness, that may not be the case at all. What are the statistics?
Yes. So I'll start with the suicide statistics, because they are very astonishing, unfortunately. Across this globe, 800,000 people die every year by suicide. And, I want to just level set here and say, when 800,000 people a year are dying and at least 10 people are significantly impacted by that death, that there are a lot of people that are dealing with that grief in silence. In the United States alone, 47,000 individuals. It's been climbing over the last 20 years. From 2000 to 2021, suicide rates are up 36%. It is the 10th leading cause of death in the United States, and it is greater than war, murders, and natural disasters. It is the second leading cause of death in children aged 10 to 14. So, it is something that we have to address. We have to bring this out of the darkness and into the light, and have conversations about it. And I tell people, I can now speak about this no differently than any other health concern, and I look at it no differently than any other health concern. I think of suicide is the outcome of someone that has an undiagnosed or untreated mental illness. It can lead to a suicide, just like someone who has undiagnosed or untreated heart disease can lead to a heart attack. And when we can put it into terms like that, and we can talk about it as a clinical disease that it is, it helps us to get rid of that shame and the guilt and all of those negative stigmas around it's, someone being lazy, or they're not fit to care for themselves. They're having a health issue. One of the things I talk a lot about in my book is about how we can take our own compassion and empathy and spread that to people that are struggling. And I talk about that a little bit when I had this heightened sense of awareness once my father passed. I could see in people's faces, I could see in their behaviors, the similar signs I saw in my father and that I was seeing in my daughter. And instead of just passing by people, I would approach them. And I have a few examples of that. One was in particular, a few weeks after my father passed, I was sitting in a coffee shop with my husband, and there was a gentleman sitting next to us, and I could tell he was struggling. He wasn't drinking any coffee. He wasn't looking at his phone. He was basically sitting in the coffee shop with his head down, and I knew something was bothering him. And I stopped my conversation with my husband. I turned to him and I said, I don't mean to bother you, but I just want you to know that I care. I can tell that you're dealing with something. I've just lost my father, so I'm going through my own stages of grief, but I want you to know that I care about you and that someone's there to care about you. That's all I had to say. I will never know if it made a difference or not, but I felt that it was important enough to say it at the time.
That's such a beautiful story. I have a friend of mine who had a similar experience in a coffee shop. She's naturally vivacious and smiles a lot, and she, good morning, hi, how are you? And was just really engaged with this person before going up to order her coffee and then leaving the coffee shop. The next day she was there and the guy was waiting and said, no one has sort of spoken to me like that for a long time. I was thinking of taking my life, and your kindness changed my whole perspective. So I think we really need to value how important it is to have kindness and compassion for others. And what are some of those early signs? I love you said that we need to start looking at the awareness of mental illness like we do with heart disease. There's early signs for prevention. So what are some of those early signs and warning signals that we should be looking for so that we can then kind of step in and assist that person on their journey to getting to better health?
Yeah, that's a great question. And there are several warning signs. The difficult thing is that a lot of these signs can be contradictory. So you can have someone who is struggling to get up in the morning, struggling to get to work on time. They may be missing a lot of work. In children, you'll see they don't want to go to school. They're disengaging or dissociating from their friends. They are agitated a lot. They're over simple things. They get very extremely agitated. That's a sign of depression. They may have these mood swings that go from one extreme to the next, meaning one day they feel like they can conquer the world, and then maybe a few weeks later, they can't get out of bed. Mood disorders are kind of a separate category of mental illness that does have a higher propensity statistically to lead to suicide. So when I say they can be the opposite, you could have someone that's a super overly, what am I trying to say? Doing and doing and doing. They're like a perfectionist, I guess you could say, because there's a linkage between people that have these perfectionist tendencies, and we see it a lot in celebrities. Like, we're surprised when we hear of a celebrity that has died by suicide, because we wouldn't expect it, because they didn't act that way. Well, sometimes there's the opposite side of the equation, where they're doing all they can to be extra, busy, and they're working really, because the mind is not stopping. The mind is continually telling them lies about themselves, and so they can to overachieve is a one way to get away from those lies or try to block those lies. So it can be both of those variables, which is difficult to understand. But if you notice significant changes in someone's mood, or you notice that there's something that's different, just ask. Just say, are you contemplating harming yourself? I'm just concerned. And it can be that simple. Are you contemplating harming yourself? And they may be taken aback, but that's okay. You just say, you know what? I care so much about you that I wanted to make sure you're okay. But you also may be opening the door for them to say, yeah, I'm really struggling. And if they say that, then continue to listen and say, tell me more. What does that feel like? Has it ever gotten to the point that you've wanted to end your life? Have you thought about that? If they continue to tell you yes to those things, you're in a crisis situation and you need to get them immediate help.
So what would be that next step? Now you've had someone open up and share, and that can be a little daunting. What do you do as that next step?
Yes, it can be very daunting. So the next step is that you take them to an emergency center, or you take them to a behavioral health hospital if you have one in your area, and you walk in to the emergency area and you say, I'm here because either you personally or the person you're with is having a psychological crisis. That's what you tell them. And we need someone to evaluate and see what kind of treatment we need to get. Now, if it's someone that says, no, I'm not thinking of harming myself, but I am having a really difficult time. I'm going through some severe depression. You can go to your family doctor first. That's your first line of step, is to get into your family doctor who can make an assessment to determine what additional treatment you need. One of our biggest challenges is that we have a lack of health care in the mental and behavioral health services area. And what I mean by that is it can take months to get in to see a psychiatrist. So do not wait. People do not have the time to wait. Take action. If it means going, like I said, to an emergency facility, do that first. If it means going to your family doctor and saying, listen, something's not right. These are the symptoms I'm having. That will lead you down the next path, the next step. And also find yourself a good therapist. Find a social worker, a licensed clinical therapist or provider that can help you begin to talk through some of these things. It's always usually a combination of talk therapy as well as a lot of times medication. But there are many therapies. There are many things that you can do. And it's no different than taking care of your physical health. Things like getting adequate sleep, eating very healthy, exercising, those are the types of things that'll help your mental wellness just as much as your physical wellness. And things like meditation, visualization, I call them grounding techniques.
Let me break in here because I can already hear my listeners asking a question, and I have my own opinion. I believe this is curable. In other words, and you're there. This is not an indictment for the rest of your life to take drugs. If you get somebody who is on that verge, that may be a beginning, but I have seen it. We have witnessed it. You can cure yourself of depression, of mood swings, even of mental illness with a lot of the things that you're talking about. And sometimes it's just as simple as, oh, I've been eating incorrectly. Oh, I've had this. Oh, this has been, and people feel so much better. And then they start having a sense of self-worth. And that seems to then grow. So this is what we teach as well. So I don't want anybody here to think, well, I'm not sure I want to take this person to the psychiatrist because this is going to be, the rest of their life, they're going to be on drugs. So that just isn't the case.
Yeah. I mean, I will say, I don't know if I would say curable. I think that people that have severe mental disorders do have them for the rest of their lives, but they are treatable. Treatable is what I would say. And there are many treatments that can help, not just medications, not just, there are treatments that everyone has a different level. I think we're all on this continuum of mental wellness, right? And in some severe cases, I would say that there's probably, I would never tell someone to go off their medication if they've been told by a doctor to do that, because there are some severe cases where that is necessary with the chemical imbalances going on in their body. But I would also say that there are other treatments that will help to make the life and the enjoyment in life better for a person. I mean, my daughter is one of those people, and she will always have her disease, but she is now in a treatable state and in a more stable state. And she can see the differences between now when she didn't understand what was going on in her mood swings and her mood instabilities. Now she sees that and understands it and knows how to take care of it, and also knows when she starts to see simple symptoms coming on, what she needs to do to make sure she tampers that. So yes, I think it's very much we should be talking about it as, again, any other illness that's treatable, that is, you can still live a very successful and healthy and dynamic life, no matter what life brings to us.
I'm so appreciative of this conversation because, again, it's like when we have more awareness, it can bring about changes that are needed. And so this is so important to have that awareness about it, drop the stigma. What advice? I loved that sharing your story is so important for the healing, because there's so many layers to this conversation. There's the prevention, there's the dealing with it, and then there's the grief from the loss of it. But what advice do you have for those who have experienced the loss, how they can get their story just kind of shared and out there? What advice do you have for those people who are going through that situation?
Yeah, so I write in the book about kind of 6 phases, I would call it. And I would say the first thing to do is begin an education phase. Begin to look for people who have gone through something similar, survivors like myself, who are now sharing their story. You can read my book. It has the steps that I went through. And know that there is hope. Know that there are other people going through this with you. You're not alone. This is something that you will get through. It is not a linear journey. There's no, you go from point A to point B to point C and you're great. That doesn't happen. But just know that each day and each step that you take and every healing moment, that's what I call in my book, all of the moments that I've included that are, activity type driven things, whether it's journaling or visualizations. All of those will start to add up, and you'll start to see a clear vision of where your future's going. And you will get to a point where one day you can smile and laugh and have the pure joy that you had. And you'll never be the same person you were before, because you have been forever changed. There's no doubt about that. But you can become a new version of yourself. And that new version can be a transformed, loving, caring, compassionate person that can help others in the future.
What a beautiful message of hope. So Cindy's website is thestrengthtolive.com, and such a wonderful title for your book. It is strength and courage to get through these experiences. So is there any kind of final words that you might want to share with our community watching, or anyone that's tuned into this program?
So I'd like to say 2 things. I'd like to say that the book title itself, The Strength to Live, not only honors those who have gone through a suicide loss and are coming through that grief and working through those stages, but it also is honoring those who have lost their lives to suicide, because I believe that it took all their strength to live, and they held on as long as they could. And it was probably the love of our family and friends, and they're always going to be with us. So I want you to understand that. And I want you to understand that they held on for as long as they could. And I believe that's a beautiful thing, a beautiful gift that they gave us. And I would like to just finally, I would say, I am offering, May is Mental Health Awareness Month. And so if you follow me on Instagram or Facebook at The Strength to Live, you'll see posts. I'm giving away some free copies of my book if you register. I'm also doing, as part of my awakening of this awareness, I'm giving a free seminar over 4 weeks in June. It begins June 6th and it ends on June 27th. So it's 4 Tuesdays in a row, 1-hour sessions. And I'm going to be offering that free, and I call it the Compassion Transformation Method. And it's just a training that I used myself, and what's in the book. It's techniques in the book. And if you're struggling right now or you've lost someone, I encourage you just to sign up for that and give it a try. You can go to my website, thestrengthtolive.com, and register for that.
And I'm sure, even though this is going to air quite some time after those dates. I'm sure that there's continual
always
things
be
that you
things.
have. Is that the case?
Absolutely. My website is full of resources. I have a blog that I do on there as well. So, and there's lots of different techniques that I call them, again, healing techniques that they can download from my site. For
Beautiful.
Sure.
Now, this is something I don't normally do, and I haven't even discussed it with Lee, and he's probably going to say, don't do this. But
Hey, don't do this.
I feel that in this moment, what I would like to do is to ask everyone here right now, it's not a meditation. I simply want to ask us to come into coherence with each other, allow our hearts to synchronize, and with this coherence, a love and support, because everyone watching this is here to be in service to the planet. Our intention in this moment is that anyone on this planet right now struggling with mental awareness and mental health issues that may lead to self-harming, our intention right now is that they can find a safe place to share the pain that they are going through, to find a door in their life that opens up to just to be able to share and to say their story. So let's hold that intention. Everyone on the planet who is going through self-harming pain, they have a door that opens up that allows them to share. And in this intention, let us now shift our focus that we send a wave of love and compassion to every person on the planet who is going through the loss of someone they have deeply loved, that has chosen a way out that they thought was the solution for them, that they too feel there is support for them. There are others who have been through this. They will move through this journey as a new version of themselves, but there is a light at the tunnel for them as well. And so with gratitude and love and compassion, just allow that energy to be flowing out into the planet right now. Well, I want to thank all of you for joining me in that. I also want to deeply thank you, Cindy, for the light that you are sharing on the planet right now. I think we're really, really ready to hear more of these messages and awareness.
Yes, thank you so much. And that was a beautiful, beautiful visualization that we went through, Monica. And I'm certain that it's going to help many, many people. So thank you.
You are so welcome.
Thanks, Cindy. Just great to have you.
Yeah.
And I'm sure that there's going to be a lot of more questions and people will be very interested in what can I do next and all. Just remember thestrengthtolive.com. You'll find a whole lot of resources there.
Absolutely. It's been an absolute pleasure to have you share your story with us.
Thank you so much. It's been a pleasure for me as well.
Great. Well, wonderful. That's all from us. And
Yes.
Stay tuned because we will have some more topics for our times coming in the future.